retinal nerve fiber layer in myopia, clinical implication for glaucoma. Our presenting author, Dr. Hemangi Rathi, is not there. We had our stalwart of myopia and glaucoma, Dr. Vinay Nangia sir.
Good afternoon, everyone. The topic is the retinal nerve fiber layer in myopia and what are the clinical implications for glaucoma. The retinal nerve fiber layer is an important anatomic tissue in the diagnosis and management of glaucoma. Along with the optic nerve, the retinal nerve fiber layer assessment is now a routine part of glaucoma assessment. And the retinal nerve fiber layer in normal subjects, emetropic subjects, follows a similar pattern of thickness to the neuroretinal rim in non-highly myopic eyes. So you have the inferior retinal nerve fiber layer being thicker than the superior retinal nerve fiber layer, and the superior retinal nerve fiber layer being thicker than the nasal, and the temporal RNFL is the thinnest of all. Changes in the axial length that occur in myopia are known to result in thinning of the retinal nerve fiber layer. Myopia offers significant challenges in the assessment of retinal nerve fiber layer clinically. In addition to an increased axial length, there is associated choroidal thinning and fundus tessellation. Further, there are gross anatomic variations in the shape of the eyeball with an asymmetric axial elongation associated with staphyloma. The disc itself is hard to assess because of the associated disc ovality ratio, the presence of parapapillary atrophy, the gamma zone, the pallor, and the vascular angulation at the papillae of the origin of the blood vessels, actually. The OCT offers an objective measurement of the retinal nerve fiber layer and perhaps will help us understand better what's happening to the retinal nerve fiber layer in myopia. The study included 492 eyes of myopes, subjects with tilted discs, the classical tilted discs, retinoschisis, glaucoma, and those subjects that had staphyloma, and those subjects less than 10 years were excluded for the analysis. In all, there were 376 eyes which were included, and all subjects underwent an ophthalmic evaluation. RNFL images, foveal scans, enhanced depth images of the optic disc were done. For high myopes, the high axial length settings were used. Retinal nerve fiber layer readings were recorded globally, and for the different segments, nasosuperior, nasal, nasoinferior, temporoinferior, temporal, and temporoid-superior. If you take a look at this table here, you'll see that the mean spherical equivalent was minus 5.42. The best corrected visual acuity was 0.83. The mean axial length of our subjects was 25 millimeters. The mean intraocular pressure was 14.84 millimeters, just to say that there were no patients with elevated intraocular pressure that we included, actually. The maximum width of the parapapillary atrophy in our subjects was 486. The disc diameter horizontal was 14 microns, and this diameter vertical was 1,610 microns, actually. And the mean of the maximum gamma zone was 385 microns. When we compared the retinal nerve fiber layer thickness with the normative data, we found that for the temporo-inferior, temporal, temporo-superior, and global, the retinal nerve fiber layer, the mean retinal nerve fiber layer values of all the subjects were less than the mean retinal nerve fiber layer values, normative values, actually. And then when we compared them to find out whether the difference was significant, we found that they were significantly different in t-tests for the temporo-inferior, temporal, temporo-superior, and global. All of them had a mean decreased value of minus 10, minus 11, minus 10, and minus 4.4 microns less compared to the normative values. This is a case just to show you how the retinal nerve fiber layer was seen. And you can see the disc on the right side, that's the right eye. And you'll see that there are two yellow zones. That means the percentile values are beyond the 95th and between 99, 95, and 99 percentile values. That is for the temporo-superior and temporal values. And for the left eye, again, you'll see that the temporo-superior and temporal values are less than what is considered normal, actually. And this is the second case. Again, you can see that the temporal half, all three sectors have decreased values. And the left eye, again, you have the temporo-superior and temporal values which are decreased. And just to give you an idea, this is a patient with spherical equivalent of minus 5.25 diopter in the right eye, minus 3.5 diopter in the left eye. The intraocular pressures were normal. and the right eye axial length was 25.84 millimeters and the left eye 24.83. So our study found that there were significant differences between the myopia group and the normative data for temporosuperior, temporal, temporoinferior, and for the global regions. These regions showed significantly reduced RNFL thickness values compared to normative values. The important thing is that these myopic discs appeared to be normal and they were not glaucomatous. And so you're finding retinal nerve fiber layer thinning actually. Several variables need to be considered to take into consideration. These include the differences in age, refractive error, axial length, and the intra-eye asymmetry of the axial length in the eye actually. It appears that perhaps a more refined normative database that includes myopia, at least moderate myopia, may be needed for a better assessment of the RNFL. While even this may have limitations because of the anatomic variability in each eye, but it may still be an improvement. It is important to assess the optic disc and the retinal nerve fiber layer in myopia, taking into account all aspects that have been discussed actually. The retinal nerve fiber layer variability tells us it should not be the only parameter on OCT for either diagnosing or excluding the diagnosis of glaucoma in myopia. Clinical assessment of the optic disc also continues to have an important role in the diagnosis of glaucoma in myopia. Thank you very much.
Could the RNFL variabilities be a result of reduced GCC counts in myopes? Because it is just the retina is just stretched out.
That's not true actually, at least in these patients, because what we saw was over a wide number of subjects actually. So we presented only the first part of the data actually.
But have you compared the GCC and the RNFL?
The
Glaucoma, sorry, the ganglion cell counts.
No, I'm sorry. We have not looked at the ganglion cell counts at all actually. This is just the retinal nerve fiber layer.
Because that would probably reflect people with high myopia have bizarre ganglion cell count that are different from normative data.
Yes.
So whether that is the reason that you're seeing these.
I mean, I didn't go into it, but if you saw the discs were normal actually. They look normal. They are normal actually. But the retinal nerve fiber layer showed a thinning on the temporal side.
Again, this is on the normative data. The normative data is also skewed towards normative people. It doesn't take into consideration long